Hey! How was your dental office today?
It was good. I had a few clients, but my shoulder was kind of hurting, but I did some chairside stretches in the middle of the day and it really helped, yeah.
Oh, wow.
How about you? How was your day?
It was pretty good as well.
Nice.
And today's my Friday.
Oh, nice. Cool. Did you want to watch some TV?
Yeah.
Okay, cool. I brought some chips for us too.
Alright, cool. Ooh, this is a video about how to use a pen machine.
Hey guys, quick tutorial today for taking a pano. Start by always asking if your patient has any earrings or tongue piercings, partials, or anything in the mouth. If they do, have them remove the items. Patients should also remove their glasses. Next, cover your patient with a lead vest. Be sure to put it down on the patient's back so it does not get in the way of the radiation and leave a distinctive mark on your x-ray. Have the patient face the machine and eyeball the correct height. Ask them to stand nice and tall. This will help with hunching and also allow for shoulder clearance. I just line it up until the chin rest is about under their chin. Have them tuck the chin slightly or just ask them to rest it on the blue piece. I show them the bite stick and point out the notches for their front teeth. Then place the bite stick in position. Ask the patient to bite on the stick. Slight adjustments might be necessary. Have the patient hold onto the machine. I will tell them I need their hands and will gently grab their wrists to lead them to the handhold. Next, I place my foot in front of their shoe and I say, move your feet forward until you hit my shoe. They should feel and look slightly off balance after they've completed this movement. For our machine, I tell the patient that I have two little plastic pieces that are going to hold them straight for me. Check your alignment. His head was still too high, so I dropped him down some more. Finally, tell the patient to close your lips together and swallow. Then I want you to keep your lips closed, keep your tongue on the roof of your mouth, and breathe through your nose while this goes around your head. As you step away, remind them again to breathe through their nose. Hold down the exposure button.
This is kind of boring though.
Yeah.
Did you want to change the channel?
Yeah,
See
let's
what's
change
next?
channel.
Sure.
Welcome back to another episode of Jeopardy! Dental Edition.
Ooh, Jeopardy's on! Stay on this one.
Okay.
Our contestants today will be competing for that elusive $1 million cash prize on top of their winnings. Here are the contestants.
From Surrey, a bubble tea connoisseur, Daphne.
Is that Daphne?
Oh my god, it is! Oh my god! Oh my god!
All the way from Edmonton, Alberta, her dream is to become a dog walker, Nina. From Richmond, an avid Instagram foodie, Ellen.
Our Jeopardy categories focus on a handy tool that can be found in most dental clinics, the panoramic radiographs.
Didn't we just watch a tutorial on pen machines?
Yeah, we did. That's so ironic. It's like they know we're watching.
Your categories are
Anatomy, pros and cons. Next up is how to, followed by abnormalities, and last but not least, useful uses.
Daphne, you're starting off. Pick a category.
Useful uses for 200.
Infection and sac or cavity in the skull. Ellen.
What is sinusitis?
Correct.
Useful uses for 400, please.
Useful blueprint for certain procedures like ortho, implants, dentures. Nina.
What is planning?
Be more specific.
What is treatment planning?
That's correct. Pick the next question.
Useful uses for 100.
Viewing these certain teeth that can't erupt into the mouth. Daphne.
Impacted teeth?
Yes.
Useful uses for 300.
Abnormalities and disorders in this hinge and slide joint. Ellen.
What is TMJ disorders?
Temporomandibular joint disorders. That's right.
Useful uses for 500.
What is this radiolucent lesion that can be commonly seen in panoramic radiographs? Daphne.
What is bone loss?
Nope, that's incorrect.
Aww.
Ellen.
What is mandibular fossa?
Nice try. Nope. Nina.
What is cysts?
Cysts in the jawbones. Yes, that's correct.
What is this? Of course! Of course it's that! Why can't I get it?
How to for 200?
Type of lead aprons recommended. Ellen.
What is a collarless lead apron?
Correct.
How to for 100.
Explaining the procedure is part of what? Daphne.
What is patient preparation?
You're correct.
How to for 500.
Instruct the patient to position this on the roof of the mouth and keep the position during exposure of the receptor. Daphne.
What is the X-ray film?
Nope. Ellen, Nina. Ellen.
What is the tongue?
Correct.
Of course, the tongue.
Yeah, it's to prevent that dark band on the pan X-ray because it's like an air bubble. And so for a more diagnostic X-ray, you'd want to instruct the client to close their lips and put their tongue to the roof of their mouth.
Oh, yeah, that makes sense. I guess I need a refresher.
How to for 300.
Anterior teeth must be in the grooves of this. Nina.
What is a bite block?
Correct.
Man, I bet Ellen's gonna win.
Really?
Yeah.
Nina has like a huge lead. I think she's gonna win.
She's been having, Ellen's been having good answers though.
I know, but what about Daphne? Like, she's our friend.
That's true.
We should probably cheer for her too.
Yeah. We'll see with the end results.
How to for 400.
Position the blank plane perpendicular to the floor. Daphne.
What is mid-sagittal?
Correct.
Pros and cons for 200.
What is created by earrings, tongue rings, partial or complete dentures, and retainers? Daphne.
Why am I blanking out? It's important to ask the client to remove these. The metal deflects the X-ray beam. Shoot.
Okay, you've run out of time. Ellen.
What is ghost image?
Nice.
Pros and cons 300.
The less need for this, as there are no sensors needing to be unwrapped and disinfected. Ellen.
What is infection control?
Correct.
Pros and cons for 100.
PAN machines are blank times more expensive than intraoral x-ray machines. Ellen.
What is 2 to 4 times?
Correct again.
Pros and cons for 400, please.
It's not your turn.
Pros and cons for 400.
No need for intraoral film placement will result in the increase of this.
What is client comfort?
Nina.
What is client comfort?
Good.
Yeah. Oh, good job, dude.
Pros and cons for 500.
Resultant image does not resolve the fine anatomic details that may be seen on. Daphne.
What is intraoral periapical radiograph?
Correct.
Pan anatomy for 100, please.
What is the bony landmark labeled number 11? Daphne.
What is lingual framing?
Correct. You are now out of the negative zone. Pick the next question.
Pan anatomy for 200, please.
What appears as a rounded radiopaque bulge distal to the third molar? Ellen.
What is maxillary tuberosity?
Yes.
Anatomy for 400.
Appears as a long radiopaque spine that extends from the temporal bone anterior to the mastoid process, not seen on intraoral images. Nina?
What is a styloid process?
Yes.
Oh, so close right now.
Yeah.
Panatomy for 300.
This rests in the glenoid fossa of the temporal bone. Ellen.
What is mandibular condyle?
Correct.
Anatomy for 500.
What is the curved depression located between mandibular condyle and coronoid process on the superior border of the ramus? Nina.
What is a sigmoid notch?
Yes. We have one last category, everyone. Nina is in the lead with 2,500. Ellen is not far behind her with 1,800. And Daphne is at 0. But there's still a few more questions and Final Jeopardy left. Stay tuned.
Abnormalities for 100.
What results in the ramus and posterior teeth being unequally magnified as seen on this image? Daphne.
What is head turned?
Correct. She's on the board, folks.
Abnormalities for 500, please.
What is shown on the image from having a slumped posture? Daphne.
What is cervical spine?
Correct.
Abnormalities for 300, please.
What results in a radiopaque cone-shaped structure on the image?
Ellen.
What is lead apron artifact?
Correct.
Abnormalities for 200.
What type of objects are penetrated twice by X-ray beams, producing a ghost image? Nina.
What is metallic dense objects?
Correct.
Abnormalities for 400.
Answer. Daily double. How many are you wanting to wager, Nina?
Let's make it a true daily double method.
Alright, Nina will be wagering 2,700. Here's your question. What type of errors result in a reverse smile line or exaggerated smile line?
What is positioning errors?
That's correct. You've now earned 5,400.
Oh, that was a tricky question.
Yeah, if the chin is tipped too much, the resulting image will be a reverse smile line.
Yeah.
Whereas the chin is tipped too down too much,
Yeah.
the resulting image will be an exaggerated smile.
Oh yeah, you're right. Yeah.
Yeah, and also if the positioning is too anteriorly, a skinny blurry image would appear like this.
Let's see. Oh yeah, but what if the teeth are too far back?
Then the image will appear fat and out of focus like
You're
this
right.
one.
Yeah. Oh yeah, I see.
This is a tough one. Your category is maxillary landmarks. Contestants, place your wagers. Welcome back, contestants. This is your question. What is number 7 on this video? You have 1 minute. Good luck.
Hey Jeopardy, this is your final question.
Today we'll be focusing on the maxillary landmarks on a pan X-ray. So pay attention.
Mastoid process, styloid process, external auditory meatus, glenoid fossa, articular eminence, lateral pterygoid plate, maxillary tuberosity, infraorbital foramen, orbit, incisive canal,
Incisive foramen, anterior nasal spine, nasal cavity and concha, nasal septum, hard palate, maxillary sinus, floor of maxillary sinus, zygomatic process of maxilla, zygomatic arch, hamulus.
This is our question. What is number 7?
Number 7 is a narrow space that separates the pterygoid plate and the maxilla.
It appears as a rounded radiolucent area. It is not seen in intraoral images.
So the chips good?
No, they're pretty stale actually.
Told you to buy new ones.
No. You want some?
Nah.
Your question was to identify the landmark in the video. Let's see what you came up with. Daphne, since you're in 3rd place, let's start with you. You said, what is pterygomaxillary fissure? That's correct. And how much did you wager? 600. Good work. That brings you up to 1,200. Ellen, you said temporomandibular fossa. That's incorrect. You're shaking your head. How much did it cost you? 1,500. I'm sorry, but that brings you down to 600. Nina has been in the lead for the majority of the game. Did she come up with the correct answer? Ooh, no, she did not. Did you wager anything? Oh, I'm sorry. She bet everything, so that brings you down to 0. Which means our winner is Daphne. Yes! So this is our winner, Daphne. Congratulations, Daphne, for winning $1 million on top of all her winnings. Thanks for watching our show, everyone. We'll see you next time.
This game is rigged. So rigged.
Hey guys, guess what? I won $1 million! I know! Congratulations! We just watched the episode actually.
Right, it was sick. Oh my god, they were all smart, but
We knew you were gonna win.
Yeah. But wait, hold on. You were rooting for Nina.
Well, you were rooting for Ellen. You're fake.
Okay. Well, anyways. Oh, so what are you gonna do with the money now?
Okay, well, I want to pay my student loan.
Yeah.
Second, donate Pan X-ray. And then third, dude, I really want to donate a microwave at my school.
Oh yeah,
that's a good idea.
That's a good idea.
Yeah.